What's going on, everyone? Happy Wednesday. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you had to take a test for something else, I hope you tested negative for that as well. If you did test positive for COVID or any of the other viruses, I hope you have a full and speedy recovery with no long-term issues and no long COVID issues. It is time now for the Wednesday edition of the Virus Update for Wednesday, March 19th, 2025. If you're new to my channel, welcome to my channel. This is the channel where I talk about all things viruses. You know, the latest on COVID, measles, flu, and all those other viruses that can make us sick. There's a lot of people that have gotten sick this winter from various different viruses. In fact, some people have not fully recovered from those viruses. I myself am dealing with long COVID and have not fully recovered from my winter COVID case. In fact, you may notice it today. My face is red. I sound maybe short of breath. Yeah, today has been one of those long COVID days. So, want to stay informed with what's going on with those viruses? Just subscribe down below. Give this video a thumbs up. Hit that notification bell. Share this video with anyone you know. And, of course, leave your comments down below. Alrighty, we do have a lot of things to get through today. Mainly in terms of news. And then I do want to take a look at some more wastewater sites. I found some more sites. I hope I remember which ones they are. I think I will. But I found some more wastewater sites that say, hey, COVID's starting to go up again. So we're trying to figure out what's going on here. Yesterday we found New York City was starting to rise for COVID. And now I have found more wastewater sites. So let's do the news, do some daily data, and then take a look at that. And I think that's where we will leave you for today. So I don't know how long this video will go. All right, starting off in Texas. Measles outbreak grows to 279 cases, approaching nationwide total for 2024, and I'm pretty sure we are passing the nationwide total already because, yeah, this is really bad. And get this takes us into our next story. Texas public health official predicts the measles outbreak could take a year, one full year, to contain. That's a really long time. That's a lot of chances for more exposures. That's a lot of chances for cases to start popping up in more states, stemming back to the Texas outbreak. That is just not a good thing. And I really hope we can get this back down to endemic once again, meaning where it's not 100% gone, but it's not at the level that it's at right now. A lot lower level. We need to try and contain this once again because, hey, we're seeing what's happening down there in West Texas and New Mexico. What was that number again? Yeah, 279 cases. That's quickly going to go over 300 soon. And well, if it takes a year, are we talking about a 4-digit number? Over 1,000 cases at some point? I don't know, but this is not good whatsoever. Speaking of measles, we can now take a look at what is going on in California, and Fresno County confirmed second measles case exposure warning issued. Yes, another potential case. And this time, the infected individual would be an unvaccinated adult, not a child, an adult this time. So, yeah, measles. I mean, it's a thing. And you know what? I got a feeling, even though now we may be in a law or coming out of the law, whatever we're doing with COVID, with these viruses, looks like measles is going to be keeping us busy for some time to come. Moving on now to this. Also in California, flu deaths continue to climb in California, but show signs of slowing. And we do know from CJ's report last week that California still saw a big number of flu deaths. And get this, at least 1,300 have already died of flu up to March 8th, including 19 children in California. Yeah, the actual number is 1,323 people in California have already died to the flu. And that's not good whatsoever. That just seems like a high number to me. I think it's a high number. All right, moving on to COVID for a moment. Medical Minute. Long-term heart risk from COVID-19. A study found that having a COVID-19 infection doubles the risk of cardiovascular diseases, with risk extending up to 3 years. Yep, just another way the COVID virus can do damage to your heart and cause new long-term issues. I got a whole section for it over on datareport.info where there's list of studies that talk about links to studies that talk about COVID's impact on the heart. And guess what? Here's another one that will be getting added to it. You can read the full study there because I'll be posting it there. probably by the end of today. I'm going to make sure I get that posted there today. All right, get this. Another raw pet food recall is tied to illness and deaths in cats. Remember we talked about the Savage cat food company and their chicken products? Yeah, so we have a link now. Get this. A California pet food maker has recalled its raw chicken products after they were linked to bird flu infections in 2 cats and suspected in a third in New York City. Yeah, remember we talked about New York City cat? At least I think we did. Well, now there's a link to this Savage cat food company. Yeah, that is just not a good thing. All right, tying up another loose end from the other day. Remember Tracy Morgan was sick and, well, threw up at a basketball game? Well, turns out that was food poisoning. Food poisoning is what his doctors are saying it was. It was at the Mondays Heat versus the Knicks game at Madison Square Garden, and they do say now that he is doing okay. All right, gotta share this with you, and we're just reading a headline here. COVID-19. We're no better prepared for a pandemic today than we were in 2020. I think that is a fantastic headline because it is just so true. And you're probably going, well, didn't we learn anything from COVID? You would think we would have learned something from COVID, but here's the problem. So many people are so tired of hearing about COVID, make such a joke of COVID, which is no joking matter. People get disabled, people get long COVID, and millions of people in the world have died of COVID. Yes, millions of people have died. In fact, let's read a little bit about this. On March 11, 2020, the World Health Organization declared COVID-19 a pandemic. According to official data, there have been more than 770 million cases of COVID, which have caused over 7 million deaths in 231 countries, almost 2.2 million of them in Europe. Let's repeat that again. 770 million cases and 7 million deaths. But yet there's some people, anytime a COVID story is posted on Facebook, you can see it right there. They have hit the like button, but they hit the haha one. It is not a laughing matter that people are dying of COVID, and because people are just so laid back, not taking it seriously, people don't want to clean the air, people don't want to wear masks. Yeah, we're nowhere near ready for the next pandemic. The next pandemic, when it comes, it's going to go off and do its thing. It's not a matter of if there'll be another pandemic. It's a matter of when, because people are just so laid back about these viruses. Oh yeah, I had my vaccine, I'm fine now. Okay, yes, vaccines can prevent deaths, long COVID, certain things to a degree, but you know what? They also don't mean you can't get infected. You can still get infected even if you had your vaccinations or your latest booster. All right, taking a look at this. This is New Zealand now. COVID-19 case summary. New average cases, 77. Rats uploaded average is 174. Cases in the hospital as of this past Sunday, 66. As always, they never report the ICU number. And looks like 2 deaths were added from COVID. It says here, it looks like they have had 4,600 total deaths from COVID. And change in the last week, when it says deceased, that total number has changed by 11. So maybe some of these deaths are from previous weeks, but at least I think last week was 2. I can never understand why they have several different totals like that. All right, as mentioned, datareport.info is my website where you can find various different information about many different things here. And like I said, we do have COVID's effect on the heart. There are currently 13 topics there. There'll be a 14th coming. That study you just saw a little bit ago. You'll be able to go click on the thread for it, and that'll take you a link to the full study, and you can read all about it. Alrighty, moving on to this in Canada, and we do need to refresh this. The viral activity levels have changed. COVID-19 is moderate. Flu A is moderate. Flu B is listed at low at this time, and RSV is in the moderate category at this time. UK, hopefully we will get an update from that tomorrow. I don't know if we'll have our video out before the update or not. It depends. I may do the recording early tomorrow. I'm not certain how that's going to go just yet. Air qualities today. Yeah, a mixed bag of things. We do have some poor air qualities in Nebraska, over through to the Great Lakes, parts of the Carolinas, West Coast as well, but not as bad there as it has been, but still some problems to be had. Mid-Atlantic, like southeast Pennsylvania, a few problems there as well. Taking a look at what's going on with the pollen levels for today, and we can see, yeah, from the mid-south over to the southeast, right up into the Ohio Valley, almost into the mid-Atlantic. Yeah, we're seeing a lot of red. Those are high pollen levels. We do not like seeing high pollen levels. All right, we need to take a look at Pinellas County. Let me refresh this. And we do see a few sick person calls at this time and a few other calls outstanding in various different places. Philadelphia on Tuesday had an increase, 813. Says 184 EMS incidents. I think they got this backwards. There were not 813 fire incidents yesterday. I've never seen it go that high, nor if it went that high, that'd be really bad. 813 EMS incidents, I think, is what they meant to say, or at least I hope that's what they meant instead of fire incidents. That's an awful lot of fire calls yesterday, if that was the case. All right, taking a look at what's going on in Montgomery County, Pennsylvania. Let's refresh this to make sure it's up to date. 18 total calls right now. We do see a lot of them. Respiratory emergency showing up several times. I've been seeing an increase in the number of respiratory emergency calls lately. And in Chester County, Pennsylvania, I have a screenshot from earlier. You've got to see this. I don't know what we're about to see, but this was just a little earlier, within like the last 40 minutes. Look how many sick person calls there were. 1, 2, 3, 4, 5 at a time? We have not seen that since January or early February. I'm not pleased about that. That means the number of people sick may be starting to increase again. I don't know which virus it is, but if I had my suspicion, maybe COVID or influenza B, and I say COVID possibly because you're going to see some wastewater sites rising soon. You're not going to see Chester County rising, but you are going to see some wastewater sites soon. Let's do a live look in at Chester County, can we? Maybe we can. It's not updating. Okay, guess we can't do a live look in there. Taking a look at the hospital situation in Pennsylvania, we do see one hospital near Harrisburg is having problems, and that is a behavioral health diversion. Let's see what's going on in Reading. Also a behavioral health diversion. And then when we go up to Geisinger, St. Luke's, emergency department is overcrowding. Monroe County, Pennsylvania, St. Luke's is having a problem. Lehigh Valley has a lot of problems, and a few problems in southeast Pennsylvania as well. Just trying one more time. Here we go. We can get Chester County now, and oh my, I don't know. Are these some of the sick person calls from earlier when I took a screenshot? No, they are not. Wow. So there are more. 1, 2, 3 more sick person calls. Respiratory difficulty as well. A lot of calls overall, but I'm concerned that I'm seeing sick person calls increase again here in southeast Pennsylvania. Taking a look at what's going on with New Jersey, and we see in New Jersey at this time, yeah, there's a couple hospitals having problems, but nothing terribly concerning at this time. All right, taking a look at this before we move on to New York State, and I want to show you the latest COVID variant that's taken over. Maybe you haven't seen an update in a while and you're wondering, what's the latest COVID variant in the United States? Now, mind you, our variant data is very sketchy. We can't get that many areas. LP 8.1 is at 47%. XEC is now down to 26%. KP.3.1.1 is at 5%. And then there's a whole bunch of other variants below that. We could try for some of the other regions. I don't know that we're actually going to have enough data to see anything. Let's try for Connecticut and Massachusetts. Nope, we're getting nothing there. New Jersey and New York. Can we get that? I do wonder. Let's see here. Yeah, there. And I think that's what's making up the national level. I think that's the only one that's actually updated. Speaking of that, here's New York's update for today. 743 new cases have been reported in New York State today. And when we take a look at the hospital picture, we do see slight good news. The statewide hospitalizations are at 742, but 90 in the ICU. So the hospitalizations down. The number in the ICU went up slightly. And I have to show you New York City. Unfortunately, New York City today, yeah, you'll see it here in just a second. Yeah, the hospitalization rise does continue in New York City. 359 now. So that's a good number of New York State's hospitalizations right there. 50 people in the ICU. Obviously, New York City is a very populated area, but again, not good to see this rising. I mean, they've never really had a big drop. They tried to drop, but now already New York City is rising once again. All right, taking a look at what is going on in Chicago now. And we do see influenza emergency department visits are moderate. That's down. RSV is low, flat. COVID-19 is low, and that's just at 1%. Influenza was at 2.5%. The positivity rate for influenza is at 11.2% and dropping. RSV positivity rate is at 2.8% and dropping. COVID-19 positivity is at 4.2% and dropping. Influenza A and RSV activity, both high at this time. Look at that, even a little bit of an increase for RSV activity and COVID-19 activity level at this time. You can see here it has just only gone up ever so slightly. All right, let's take a look at some data from Walgreens, and we'll start off with the national flu A and B positivity rates. And we can see currently 3.68% is the flu positivity rate for both A and B here in the United States. Total test, 4,954. And let's take a look at what's going on in the Pacific Northwest. Got to give something for you today. Washington flu A and B positivity rates is at 6.78% and total test 59. Now taking a look at what's going on in Idaho, 10% positivity rate, total test 10, and we have nothing for Oregon. Let's take a look at what's going on when it comes to COVID, and we see the national positivity rate is 13.7%, total test 4,840. Positivity rate this week did go up slightly. COVID in Washington, 16.9%. That went up by 12.5%. And prior week was 4.5%. Total test, 59 versus 67. Let's do somewhere else. Let's go to South Carolina. South Carolina's positivity rate is 12% at this time. That is down by 1.2%. Total test, 108 versus 143. All right, let's head over to wastewater. And I do have already selected Maryland, because we need to take a look at that. There's a few wastewater sites. I don't know how many we're going to do, but first, let's take that hydration break. Let's get a drink of water, because I know I need it right now. Chances are you need it as well. It is very important to keep hydrated. All right, let's go through several wastewater sites. I think I remember all the ones that I wanted to look at for today. You can also see on X and Blue Sky. I did do a post yesterday, but there's a few others that I have found since then that are rising. Take a look at this. Hollywood, Maryland. COVID levels are high. And no, this is Maryland, not California. I know they've had all those award ceremonies out there. It says nothing to do with it. This is Maryland. This is real. It's starting to rise once again in Hollywood, Maryland. Population served. Important, I think that we should show what the population sizes are of these wastewater sites, or I should be pointing them out, because there's one that you're going to see that is rather small. And we can see here, COVID, it's still listed high, and it's rising at this time. RSV is low and dropping. Influenza A is high and rising ever so slightly. Influenza B is low at this time. HMPV is low. EVD68 is low. Norovirus is still in the high category, and everything else is fine at this time. All right, I did not tweet this one out yesterday. I just found it today when I was getting ready for today's video, and I found this. Take a look at Union Beach, New Jersey. X out that wonky movement there. Take a look here. Yeah, COVID, it's high, and it is starting to rise once again there. So that's interesting. RSV is still listed at high, and I don't know, this whole little upward trend, is that a wonky movement? We'll have to see the next update to find out. Influenza A is high, Influenza B is high, and Influenza B is actually going up a little bit. HMPV is still listed high, EVD68 is low, Norovirus, again, a wonky movement, and I should explain myself. Whenever I say there's a wonky movement, what I mean by that is a couple things. One, it means it made a very erratical, sudden jump in, could be up, across, down, could be in any direction. And two, it likely indicates that there could be some incomplete data, and once that data gets filled in the later in the week, it does correct in some way, shape, or form. So that's what I mean when I say wonky movement. It means there was a movement on the chart that was just real quick within one or two update time frame. Now, when we see something, a jump like this as big, and it's like 3, 4, 5 updates, well, then it's something a little bit more serious. Hepatitis A, Mpox, Clade 2, Mpox, Clade 1B, not an issue at this wastewater site at this time. All right, let's go down south. We have to go down to Atlanta, and I believe we're going to be taking a look at a couple wastewater sites in Atlanta. Here's College Park, and someone correct me if I'm wrong. This wastewater site, 73,821 population. Someone correct me if I'm wrong. I think this may include the Atlanta airport. I honestly don't know. I forget where Atlanta's airport is. COVID, look at this. Your levels are starting to rise at this time. Yes, it's another wastewater site that's starting to rise. And we can see RSV is high. COVID is high as well. RSV, not terribly concerned right now. Influenza A has seen a slight rise, but again, wonky movement. Influenza B is low. HMPV, wonky movement upward. Incomplete data, likely, but again, there's been a lot of up, down movements with HMPV at this wastewater site. EVD68 is low. Norovirus is high at this time. And take a look at that. There was a detection of Mpox on January 28th, and some smaller detections just before and just after that. So something we will have to keep an eye on. Now moving a bit further north, and I want to say it's this Little River. Roswell is the other one that I saw, right? Yes. Take a look at this wastewater site. Now, this is not a big population. 12,818 people served. But for whatever reason, this wastewater site just went way up. Take a look at that. 1 detection, 2, 3 updates. So we'll have to see what happens. Even if this corrects to being less harsh, that would have to be a massive correction to not show it still going upward of some sort. So that is very concerning for COVID. That is a really high level. RSV at this time is low. Influenza A is still high. Influenza B is low. HMPV is low. EVD68 is low. Norovirus is creeping up a little bit as well. And everything else is in the clear at this time. So that is really concerning. Now let's just randomly take a look at a few wastewater sites. Whether they're rising or not will remain to be seen. Memphis, Tennessee, you look to be flat at this time. RSV is flat. Influenza A, not calculated. And again, that is flat at this time. Influenza B, HMPV, and EVD68, all not being seen. Norovirus is rising slightly at this wastewater site. Hepatitis A, some detections of that. No Mpox issues at this time. And let's continue on here. What is going on in Harrison, Arkansas? I want to know. And we can see here, your COVID levels are actually low for a change. You started the year with very high COVID levels, ending last year, coming into this year, and now you're down at low levels. RSV is still high. Influenza A is high. Influenza B is low. HMPV is low. EVD68, not detected. Norovirus, that's starting to rise once again. That's a bit of a concern. And everything else is fine at this time. Making our way even further out west, let's go out to Utah. Let's go near Salt Lake City and see what's happening there. And we can see in Salt Lake City, just an ever so slight rise for your COVID levels at this time. They're still listed at low, but obviously that's something we will have to keep an eye on. RSV is still listed at high. Influenza A is high. Influenza B is high. HMPV is still listed at high. EVD68 is low. Norovirus is in the medium at this time. And everything else, well, no. Hepatitis, there have been some detections of that. It is in the low category, though, at this time. And those detections are not recent. They're probably at or just over a month ago. All right, let's do one more wastewater site. And let's go up to Mount Pleasant, Michigan, and see what's going on there. And we can see the COVID levels are listed at high and ever so slight rise on the most recent update. But again, it could be incomplete data, aka a wonky movement. RSV at this time, it is high, and overall, take a look at this. Overall, since February 28th, you are starting to slightly trend back up once again. Influenza A has stopped dropping for the moment. It's still listed in the high category. RSV is also high. Influenza B is low. HMPV is low. EVD68 is low. Norovirus, it's in the high category, and 1 update, 2 update, 3, 4. Yeah, several updates. It's going upward once again. No hepatitis or Mpox detections at this time. Alrighty, folks. That does it for the Wednesday edition of the Virus Update. If you enjoyed this update, give it a thumbs up. Subscribe down below. Hit that notification bell. Share this video with anyone you know. And, of course, leave your comments down below. Hey, I'll keep looking around if I see any more interesting indications that may suggest, hey, something's going on when it comes to COVID rising again in some of these wastewater sites. Of course, I will include them in the next update. Until I see you again next time, stay safe, everyone, and have a fantastic Wednesday afternoon. Thanks for watching.